We'll go ahead and call the meeting to order. Thank you all for being with us online and for those who are here personally today. Reminder before we call the roll here that members who are participating remotely, when you are answering the roll call, please indicate if you are here in your LRC office or you are in a district office. Everyone should be muted unless actively speaking in the meeting. And if you have questions, please use the chat feature to notify staff, and they will let me know to be able to call on you as we proceed through today's meeting. At this time, I'm going to ask the Madam Secretary, please call the roll.
Senator Rocky Adams. Senator Berg.
Present in district.
Thank you. Senator Harper Angel.
Present remotely off campus.
Thank you. Senator Storm. Senator Westerfield.
Here from Crofton.
Thank you. Representative Banta.
Here in the 63rd.
Thank you. Representative Beckler. Representative Raymond.
I'm here from my district.
Thank you. Representative Stevenson. Representative Tate. Chairman Meade.
Here. Chair declares a quorum and we are ready to proceed. At this time, we'll now approve the minutes for the July 15th, 2021 meeting. Is there a motion to do so? And for those of you that are joining us virtually, I will tell you that I am the only member sitting in this room right now, so I'm going to need some of you to speak up.
So moved.
I have a motion by Senator Westerfield. Is there a second?
Second.
Second.
Motion made and seconded by Senator Harper Angel. With that, Madam Secretary, please call the roll.
No, that was just the minutes.
Oh, that was just the minutes. Voice vote. Okay. All right. For all those in favor, please signify by saying aye.
Aye.
All opposed, nay.
Aye.
Motion carries and the minutes are approved. Next is we're going to go ahead and get started with the agenda for today. This will be the Cabinet and Prevention Services for Families. As you may or may not know, in the previous budget that we just passed, we allocated $20 million for prevention services. This is one-time funding that came from some of the CARES or ARPA money. I'm not sure exactly which pool that came out of, but we're going to ask the Cabinet to give us an update on that and the state of the physical state as we move forward here. So I'll go ahead and turn that over to, I'm not sure if Krista Bell is going to be the first one, but whoever's speaking, please state your name for the record and you may proceed.
Thank you. Good afternoon. I am Krista Bell. I'm an executive advisor with the Department for Community-Based Services, and I would like to thank the committee chairs and this committee for the opportunity to present this information today, as well as for this additional appropriation of funding to support our prevention efforts. I am the only presenter on this topic today. However, Misty Sammons, who is the director of our Division of Administration and Financial Management, is on hand to answer any budget or fiscal related questions at the end should those arise. And I will share my presentation. Can everyone see that?
We can see it here in the room. Hopefully everyone can see it online.
Thank you. I wanted to start just by providing some context or some history with regard to how we came to our current approach to prevention. So as probably everyone in this committee knows, there were historic challenges that the Child Welfare Agency was facing. Over a period of 6 or more years, we saw increasing numbers in our out-of-home care population. This led to unmanageable caseloads for our workers, further, exacerbating that struggle to serve families with the type of quality services that we wanted to provide. We also struggled with funding. In order to pull down Title IV-E funding from the federal level, a child has to be in out-of-home care and meet certain requirements for 4E eligibility and reimbursability. So the majority of those costs for out-of-home care services had to come from other sources other than federal funding, federal Title IV-E funding. We also saw an increasing number of youth leaving care without achieving permanency, either through foster care or through return to parent or through adoption. And we were seeing a high use, higher than we wanted to, of residential or congregate care facilities, rather than children being able to be maintained in the community or in family-based settings. Kentucky was also one of the lowest states in terms of the percentage of children in out-of-home care population who were placed with relatives. As every other child welfare agency in the nation experiences, we also had disproportionality and disparate outcomes for our youth of color who were served in our child welfare system. We also have historically had some unintended consequences of the mandatory reporting laws. And while the mandatory reporting laws are necessary and very well intended to ensure that children who are the victims of maltreatment are brought to the attention of people who can help them, it does have an unintended consequence of DCBS becoming sort of a one-stop shop for services. And so those, with Kentucky having universal mandatory reporting, those who make a report to the DCBS agency think at that point that they have connected that child and family to the services and supports that they need. But in reality, less than half the reports that come into DCBS meet the statutory and regulatory requirements or criteria for DCBS to provide any type of services. And unfortunately, most times those families and children are not connected to meaningful services in a structured way. There's also stigma, of course, related to DCBS involvement. So when families do start to struggle, they're not likely to reach out to DCBS to ask for help themselves. So we operated this way in child welfare, not just in Kentucky, but across the nation, which we were a very reactive system. And I think this quote by Maya Angelou is very fitting, that you do the best you can until you know better. Then when you know better, you do better. So several years back, there was a lot of advocacy for increased investment in prevention services. So rather than focusing the majority of our efforts on trying to treat the problem once, maltreatment had already occurred to a child and that trauma had occurred, the focus became to invest more resources on the front end to try to prevent that child abuse and neglect from ever occurring to begin with. And so Kentucky really did have unprecedented opportunity through the Family First Prevention Services Act, which was passed at the federal level in 2018. Kentucky was one of only a handful of early implementers because we really saw this as an opportunity to expand our prevention services, and the intent of the act really aligned with our values in Kentucky. Over the past couple of years, we've also seen some increases in other funding for prevention, actually just this year. So in addition to the $20 million additional appropriation that we received for this state fiscal year out of this last legislative session, we also received supplemental community-based child abuse prevention funding from the federal level. So that is one-time funding to be used over the next 5 years for primary and secondary prevention. So that's to serve families who are not yet child welfare involved to avoid future involvement with a child welfare agency. We also have been able to take advantage of national initiatives and support around these prevention efforts, and to leverage community partnerships and support for prevention. We have community providers who are doing some excellent work in the area of prevention. And so we have been able to leverage those partnerships to try to build collaboration, communication, and to replicate the things that we know are going well and have been affected on a community-based level. We also are focusing on our equity work to address disproportionality and disparate outcomes that we see for children and families of color involved in our child welfare system. We have expanded our race, community, and child welfare groups to every region across our state. by which we are engaging our community partners in real actionable solutions to address disproportionality and disparate outcomes. We also have been able to align our prevention efforts across agencies, both public and private agencies, and really taking advantage and leveraging those partnerships to ensure that we're all pushing in the same direction. And so, like I said, we know that we have had programs that have been very successful, but very often we were working in a fragmented or siloed way. We've really been able to make great strides in aligning those efforts so that we're all working toward a common goal. And we are working on implementing community response models. And I'm going to talk a little bit more about that later in the presentation. But I did want to share the total impact of our Families First prevention efforts. So the programs that we have in Kentucky, in which we are utilizing the approved Family First evidence-based practices, are our family preservation programs, or FPP, Kentucky Strengthening Ties and Empowering Parents, or K-STEP, and our sobriety treatment and recovery teams, also known as START. So the statewide numbers served for all of our Family First services, prevention services in state fiscal year 2020 were 3,367 families served, which included 6,132 children. The children who remained in the home at the closure of those services was 5,706. And so this is 5,706 children who were at risk of entering our out-of-home care system if not for the provision of those services. Kentucky has a really high success rate with our Family First prevention services, with 93% of children served remaining at home. We have just compiled our state fiscal year 21 numbers, which are very close to the same. The number of families served across all three program types in state fiscal year 21 was 3,084, and that included 5,998 children. So one of the ways that we look at the success of our prevention efforts is by looking at our out-of-home care trends. And so I mentioned earlier that over a period of 6 or more years, we saw those out-of-home care numbers continue to rise. And it would be very difficult to state a direct cause and effect relationship between any one thing that we have done to try to impact these numbers. But of course, it is something that we want to look at and to monitor and to measure the effectiveness of our prevention services. We implemented Family First on October 1st, 2019, and then of course, 2020 brought a global pandemic. So it will be impossible for us to ever tease out what was the result of our intentional efforts around prevention or expansion of prevention services, and what may have been the impact of reduced calls or reports to our hotline. But one of the other things that I want to point out that is important to consider when we look about things that impact our out-of-home care trend lines is that we had another very significant shift in our practices on April 1st, 2019. This is when we rolled out our expanded relative service array, in which we created a new child-specific foster home type and also made it much easier and clearer for relatives to become approved as any type of foster care provider that they qualified for. And so when you look at this lowest number on this trend, in September of 2015, there were 7,711 children in out-of-home care. But in September 2015, there were only 275 children in the custody of the cabinet placed with relatives. That's just 3.6%. And that's because prior to April 1st, 2019, it was most customary when a relative was identified for that relative to be given custody directly rather than that child remaining committed to or in the custody of the cabinet or part of our out-of-home care population. So by comparison, when you see the most recent number on this trend line, 9,122, that's from June of 2021. In June of 2021, there were 1,408 children placed with relatives, or 15.4% of our out-of-home care population. If we were still practicing the way that we used to prior to April 1st, 2019, there would be 7,714 children in out-of-home care, which is almost identical to that lowest point on this trend line. So I think that's a very important consideration. And that was a change that needed to occur for those relatives to be able to be approved as foster parents and that to be a common practice. But it is, when we're looking at our trend line over a period of 6 years, it is an important factor to consider because we're not looking at the same thing in June of 2021 that we were looking at in September of 2015. And this stacked bar graph shows our expenditures for various types of programming. So you see at the bottom for state fiscal year 2019, 2020, and 2021, the blue is our prevention expenditures under those programs that fall under Family First. So that's our FPP services, K-STEP, and START. That's the total expenditures. In the red is our out-of-home care expenditures. So this is mostly per diems to foster care providers, to residential facilities, and those things that are the true cost of care for children in our out-of-home care system. And then the green at the top are expenses associated with supporting children's permanency through adoption. So this could include post-adoption subsidies, but it also includes the cost of pre-adoptive placements, attorney fees. It also includes post-adoption placement stabilization services. So if a child needs treatment in a residential setting after adoption finalization, those costs are reflected here as well. So the way that you can think about this is the blue are our prevention expenditures, and everything above the blue are costs that would be avoided if children never entered out-of-home care. And so we implemented Family First in state fiscal year 2020. There were just 3 quarters. We implemented October 1st, so there were just 3 quarters of Family First services. But in that state fiscal year, we increased our prevention expenditures by $6.5 million. And we reduced our out-of-home care costs by $23.4 million. In state fiscal year 2021, which is actually the first full fiscal year in which Family First services were in place, we increased an additional $3.1 million in prevention expenditures and reduced out-of-home care costs by $34.7 million. So over these 2 state fiscal years, prevention expenditures increased $9.6 million. Out-of-home care costs decreased $58.1 million. And so you can see across these 3 years that our adoption expenditures also increased. But when you total all 3 of these types of expenditures together between state fiscal year 2019 and state fiscal year 2021, that is a savings of more than $33 million. And so this slide shows what I think we all know is true, that sort of that old adage that an ounce of prevention is worth a pound of cure. And I think we certainly see that in our expenditures on prevention. But one of the things that we can't see in a bar graph, or that we can't see quite as well, is what we save a child and family in terms of trauma when a child doesn't have to be removed from their parents, when they're allowed to stay in their community, in their school, in a place where they have friends. And so that really is even the greater impact of what we're able to accomplish by increased investments in prevention services. So I want to talk real quickly, because we talk a lot in child welfare about primary, secondary, and tertiary prevention. So I just wanted to share these definitions from the Child Welfare Information Gateway so that we all have the same understanding, or we're talking about the same things when we use these terms. So primary prevention refers to activities that are directed at the general population. They're available to all members of a community. So these are things like awareness campaigns, like from Prevent Child Abuse Kentucky. This means access to high quality childcare. It could be public service announcements about positive parenting. So these things are available to everyone. It's intended to prevent maltreatment before it ever occurs. Secondary prevention activities are focused on populations that are at high risk. So they have one or more risk factors that might be associated with child maltreatment. So when you think about secondary prevention, we're talking about things like the HANDS program that most people are familiar with, or parenting classes for teen parents, respite for children, for parents of children with special needs. Those are secondary prevention activities. And then tertiary prevention activities focus on families where maltreatment has already occurred, and they're seeking to reduce either the negative consequences of that maltreatment or to prevent its recurrence, or oftentimes it's intended to prevent entry into out-of-home care. And so I think that this picture is a really good visual of how we can conceptualize primary, secondary, and tertiary prevention. So if you see the bridge on the left, that is primary prevention. If everyone could just go across the bridge, they would never end up in this stream or be at risk of falling over this waterfall. This sort of picket fence looking thing that someone has put across this stream is intended to prevent anyone from going over that waterfall. But at the point that you're having to utilize the picket fence, you're already at risk. You're already in the water and headed toward that waterfall. So that picket fence is really a secondary prevention measure. And then here you see this net intended to catch, whoever may go over that waterfall in an ambulance here at the bottom. And that's really what we think about when we think about tertiary prevention. So the net catches them once they've already gone over, but it's helping them to avoid the worst consequences of having suffered that. So most of or actually all of our family first services are in this area of tertiary prevention. Something has already happened, but we're trying to mitigate the worst consequences, and we're trying to prevent that from happening again or prevent entry into out-of-home care. And of course, the cost of each of these types of prevention efforts increase as you go from primary to secondary prevention. So we're really trying to get more upstream to secondary and ultimately to primary prevention, and reduce the amount of time that we're spending in tertiary prevention once something has already occurred. And so with that, I wanted to share how the Cabinet's plan for how we intend to utilize this additional $20 million appropriated by the legislature for use in this state fiscal year. So as I said before, we know that our services under Family First are very effective, and they're preventing children from coming into out-of-home care when services allow them to stay at home with their parents safely. And so we do intend to expand our FPP services by an additional 25%. We also intend to expand K-STEP into all the counties of our Salt River Trail service region and 3 counties in the Cumberland service region as well. We also want to increase flex funds for families, and I'll talk about that more in just a second. And then we have started 3 pilots of multi-systemic therapy. And multi-systemic therapy is an approved evidence-based practices under our Family First prevention plan. And then finally, we are creating learning collaboratives to increase capacity to provide evidence-based practices in Kentucky. So all of the evidence-based practices that are under our Family First prevention plan require clinicians with certain credentials. And that actually has been a bit of a challenge in Kentucky. So these learning collaboratives are intended to increase our capacity of clinicians in our state to be able to provide those services. And I'm going to just share a little bit more about the impacts of each one of those. So as I stated earlier, FPP is the largest program under Family First, serving almost 5,000 children in state fiscal year 2020 and also in state fiscal year 21. FPP is available to families in every county in the state. And it is designed to address needs related to substance use, mental health, and in-home parenting skills. So regardless of which category that family's need falls into, FPP has services that address that need. In state fiscal year 2020, 93% of children who received FPP services remained in the home at the time of closure. And these positive effects are sustained because 92% of them are still in the home after 6 months. With the new data that we have just compiled for state fiscal year 21, FPP was actually 94% effective in state fiscal year 21 in keeping children safely at home with their parents. A 25% expansion will ensure that there are no waiting lists for these services anywhere in the state. So even with the expansions that we have already made, we still have some areas of the state where there are waiting lists for these services. And no child should ever have to enter our out-of-home care system because we don't have access to those services immediately. So this expansion will allow us to reduce those or eliminate those waiting lists. Likewise, our Kentucky Strengthening Ties and Empowering Parents, or KSTEP, has had the same success rate of 93%. KSTEP began in 2017, serving only 4 counties in our Northeastern service region. It was a project of our Title IV demonstration waiver. We expanded to serve 4 additional counties at the beginning of state fiscal year 2020. And then with that initial expansion under Family First, we expanded to all 15 counties in the Northeastern service region by the end of state fiscal year 20. We then expanded to 3 counties in the Salt River Trail service region in state fiscal year 21, and we utilized grant funds in order to be able to do that. So again, KSTEP served 202 families and 380 children in state fiscal year 20 with a 93% success rate. The long-term goal is for KSTEP to be available in every region in the state, and this additional appropriation will allow us to expand to the rest of Salt River Trail and into Cumberland service region. Multi-systemic therapy is an intensive family and community-based treatment for youth with high-risk behaviors related to either substance use or mental health needs. So DCBS has partnered with the Department for Medicaid and with 3 private providers on a 3-year MST pilot. One provider has an executed contract already, and that began July 1st, 2021. And there are 2 others that are currently being negotiated, and they should be executed within the next couple of months or this fall. MST has a very high success rate with youth who often end up in the highest levels of care. So these are our youth who may have dual involvement with Department for Juvenile Justice. These are youth who very often end up in detention. They have very high risk behaviors. If they come into care, these are our youth who often end up being placed in residential facilities. So this pilot will serve families in Jefferson, Northern Kentucky, and Central Kentucky. I had mentioned flex funds just a few minutes ago. So there are flex funds that are included in our Family First evidence-based practices. And right now, the limit on those flex funds is $500 per family. There is a lot of research that shows that the provision of concrete supports for families is results in diversion from entering the child welfare system or entering out-of-home care. Multiple research studies show that family income is a predictor of entry into care, and that families living in poverty are significantly more likely to become involved with the child welfare system. So what Flex Fund can do is, say, for example, transportation is a barrier to a family being able to maintain employment. Flex funds can help with a car repair or can help give that family access to transportation. So there's no opportunity for fraud with these flex funds because the provider with whom we have a contract determines whether there's a need for flex funds based on the assessment of that family's needs. But as you likely know, a $500 maximum does not always cover whatever the barrier or challenge that family may be having. So increasing those flex funds to $1,000 per family can really help to alleviate some of those barriers to success. We also, in addition to expansion of our Family First services, we also want to expand some work that we're doing under primary and secondary prevention efforts. So a small portion of that $20 million appropriated, in addition to use of our supplemental community-based and child abuse prevention or CBCAP funds that we get from the federal level, will be used to establish and implement community response pilots. And I'm going to explain a little bit more about that in just a second. We also want to expand our parent engagement meetings in additional counties. We have these in a few counties in Kentucky right now. These services focus on families that would come to the attention of the cabinet because of educational neglect. The data on the outcomes of these, the services that we're providing now with CBCAP funds is extremely impressive. And it not only avoids child welfare involvement, but it also saves the school systems a lot of money because of increased attendance. And so we want to expand those into 10 additional counties. We also want to increase our in-home service prevention under community collaborations for children. So community collaborations for children is available in every region across the state, and it provides services to families before they become child welfare involved. So it is a very successful secondary prevention effort. Under that community collaborations for children, there are also client assistance funds, which is the same as flex funds. And so just the same as we wanted to increase those under our Family First prevention services, we want to increase the maximum on those under our community collaborations for children, because we know that access to sometimes something that is a one-time barrier can really help a family and prevent future child welfare involvement. We also have created a prevention collaborative. I mentioned earlier that we knew that we had good prevention work going on in small areas or small pockets across the state. But the Prevention Collaborative is intended to bring our community partners and stakeholders together to share successes and challenges, and to be able to provide a structure to replicate things that are going well in different communities. We also know that it's really difficult for us to sit in Frankfurt and figure out what is going to work well in every community across the state. So we know that communities know best what communities need, and families know best what families need. So the creation of that prevention collaborative that then can be replicated at the community level ensures that prevention services are community-based and family and youth-driven. And then we have also been selected as a round 2 jurisdiction under a national initiative known as Thriving Families, Safer Children. And while this is not a grant, we don't receive any funds from that. And there's actually no cost for being part of that. We don't need funds to be part of that. It does give us the opportunity for consultants at the national level, technical assistance, and opportunities for peer-to-peer communication with other jurisdictions nationally who are doing great innovative work in the area of prevention. And so lastly, I just wanted to share a little bit more about our community response, because at the beginning of the presentation, I talked about the unintended consequences of mandatory reporting. So less than half of reports to DCBS meet criteria for us to provide any type of service or response. And unfortunately, more than half those reports, that family and child is not connected to any type of resource or support in a meaningful way. So what a community response model will do is that for those reports that do not meet acceptance criteria for DCBS, those families will be referred to a community-based agency to offer supports and resources to the family, either through the direct provision of services or also utilizing Connect as a way to identify resources for those families. The overall goal of a community response model is to strengthen families and prevent child abuse and neglect. And other states have had great success in this, and they've utilized partnerships with their family resource youth service centers or other community-based agencies to make this work. I would be remiss if I didn't mention that there are some challenges in being able to spend this $20 million in this state fiscal year. The Consolidated Appropriations Act at the federal level temporarily increased our federal reimbursement rate for Family First prevention services to 100% through September 30th of 2021. So for the past few months, rather than having a 50% federal reimbursement for those services, we are able to claim 100% reimbursement for those services, and that does extend through September 30th. So that leaves just 3 quarters for us to be able to utilize the additional $20 million appropriated for Family First services. We are working very hard, as I said, have been working for a while to expand K-STEP and to expand FPP. Historically, those programs need 3 to 6 months to scale up. DCBS has hired 4 additional staff in our central office in Frankfurt to be able to spearhead that work and get those programs scaled up as quickly as possible. And there's currently a request for proposals posted for our FPP services that will lead to new contracts this fall. So that RFP is posted now and closes August 27th. Some of our FPP providers have experienced recent challenges with hiring qualified and credentialed staff. So that's part of what we hope to address with the learning collaboratives, but that has been a barrier to them being able to scale up quickly. I want to thank the committee again for the opportunity to share this information. We're really excited about the opportunity to expand our prevention services. We know that leads to positive outcomes for children and families. And I would be happy to answer any questions.
Thank you, Krista, for the presentation. And are there some members with questions? I see Senator Byrd first.
Thank you, Chairman, and thank you, Krista, for your presentation. Real quickly, I actually have 2 questions, if that's okay. My first was for MST, for the multi-systemic therapy. Is the age cutoff for eligibility on that 18, or can we include college age students in that program?
So under any of the evidence-based practices, we have to adhere to the model that has been approved on the federal clearinghouse. And I believe that the age range for MST is ages 12 to 17.
Thank you, thank you. And then I guess my second question, which probably is more of a broad, you don't have to answer a question. Is it possible, if we're having such a shortage in licensed, trained healthcare providers throughout the state, is it possible that any of this money can go to incentivize people to get the training as long as they agree to stay in the state and utilize, their education here? Is that something anybody's considering?
I think that's a great suggestion. I will say that the licensure board for clinical social workers has been very good partners to us, and have really listened to some of our concerns about implementation of family first requirements, not just for prevention, but also for the requirements related to qualified residential treatment programs. So I do think that we have good partners in being receptive to that. One of the reasons we actually started working on the request for proposals some months back, even prior to knowing that we would get an additional appropriation. And one of the reasons that we wanted to do that is to allow the opportunity for different rate setting, with the idea that higher rates of pay for providers may help with recruitment and retention. So we are utilizing some strategies to try to help with those hiring challenges. But I do think that that's a good suggestion, and we haven't explored that specifically.
Thank you very much. And again, thank you for your presentation.
Representative Beckler.
Thank you, Mr. Chairman. Crystal, I was very interested in the presentation. Thank you. Taking a look at the slides that are associated with K-STEP and the MST, I was disappointed to see that there was nothing listed for Western Kentucky. I was curious how you made the decisions for the areas that you did: Salt River Trail, Northern Kentucky, Central Kentucky, etc., but nothing for Western Kentucky.
Sure. That's a great question. I can't speak to how the initial decision was made to start with Northeastern service region back when it was a Title 40 waiver demonstration project. But when we started to expand beyond Northeastern, the way that we made those decisions was by looking at our data. We do capture data about case characteristics or factors that are present at the time of a substantiation child abuse or neglect, and one of those is the use of substances. And so K-STEP specifically provides services for that need. And so we looked at the prevalence of substance use being a case characteristic. And that's how we decided where to expand. And so that's also how we made the decision. It made sense since we had started in Salt River Trail to expand to the rest of Salt River Trail. But that's also how we made the decision for Cumberland. We do intend for K-STEP to be prioritized for rural areas of the state. So certainly Western Kentucky would be a next step, as well as our Eastern Mountain service region in terms of expansion.
Any idea when that decision to expand to those areas will be made? Not only when the decision is made, but when the expansion will also begin?
We don't have a firm timeline right now. It is a conversation that we're currently having. The concern about, we would love to go ahead and expand now, just being fully transparent. The concern about just expanding now to the remaining rural areas of the state is being able to sustain that. As I said, our expansion to Salt River Trail, we were able to do because of grant funding through the core grant. So that's the reason that we're being cautious, is that we don't want to expand and then have to scale back on those services because of a lack of funding. So it's just a matter of solving what our long-term plan is for sustainability.
All right. Hope it's soon for Western Kentucky. Thank you very much. Thank you, Mr. Chairman.
Right now, I don't have any other members that are asking to speak virtually, so I've got a list of questions here that I have compiled. Actually, I had some members send me some questions, as well as some other folks who are involved in this process across the state. So I've got a list of those, and I'll just start going through those. Krista, if you could answer those. You've already kind of explained the barriers that exist to spending the entire $20 million, so we'll move on to, I think that was your last slide. But the next question is, it appears that you are going to start some new programs with this, and you're also going to expand some current programs. It says, how will these programs be sustained since this $20 million is one-time funding?
That's a great question, and certainly is part of the challenge for us, as I just said, with regard to the question about statewide expansion of K-STEP. We do have some federal funds that were made available through the Family First Transition Act. We have been very conservative with the use of those funds. We have until September 30th of 2025 to be able to utilize what was its one-time funding, but it had a number of years to be able to utilize that. So we are reserving the majority of that funding intentionally to help with sustaining expansions if we need to utilize that funding. In 2026, the Family First Prevention Services Act provides for 50% federal reimbursement, but in 2026, that federal reimbursement goes up to the state's FMAP rate. And while that FMAP rate for Kentucky fluctuates, it is at approximately 70%. So that would increase our percentage of federal reimbursement on October 1st of 2026. So really, we just need a good plan to get from the time that this funding can be used at the end of this state fiscal year until October 1st of 2026. Utilizing that Family First Transition Act funding is one strategy. And as I said, we have reserved the majority of that funding to be able to rely upon if we need to help bridge that gap.
Then the next question I have is, with the implementation of Family First in 2019, how much Title IV-E prevention funds has Kentucky drawn down so far, and how does this compare to the amount Kentucky was previously spending on prevention services? And then a continuation of that is, what barriers exist to significantly increasing the amount of federal 4E prevention funds that Kentucky draws down?
So I think that I'm going to have to ask Misty perhaps to answer part of this question. The slide that I shared with the stacked bar graph in the blue, that shows our total prevention expenditures. And so that answers the question in part. I personally cannot answer the question about the amount of 4E reimbursement that we have been able to be reimbursed for as a result of claiming. So I don't know if Misty can perhaps help with that part of the question.
This is Misty Salmons. I don't have that like available right now, but I can have Laura Began email it to you when I get it pulled together for you.
That'll be fine. Thank you. And then some of these questions I have written down for myself as we went through this presentation, and I'll say that I understand that you can't say a whole lot about the RFPs and things that are out there right now, but I think it's important that you all hear some of the things that we've been getting as far as calls and concerns from providers saying that they're not going to be able to submit a proposal because most providers are not capable of doing a large-scale implementation immediately. And there's an uncertainty of funding because of providing leases and obtaining equipments and those type of things and training staff. Also, based on how the RFP is structured, they have some concerns that not many providers will be able to respond to that RFP. And that may decrease the state's chances of having good quality providers and actually expanding prevention services. How would you all answer that?
I can't comment on the RFP because it is currently posted. What I will say is that we established this prevention collaborative that right now has over 100 participants that are community partners, community-based providers. They are, stakeholders. So parents with lived experience with the child welfare system and those with an interest in prevention and serving families. We are utilizing that prevention collaborative to develop a formal plan for primary and secondary prevention. And we welcome partnership with providers who want to help with this prevention work. It is not all limited to FPP is just one program under Family First. So there are a lot of opportunities for providers who want to serve families in their communities to be able to do that if they don't feel like this current RFP is a good fit for them. And I would just say we welcome those conversations. Okay.
Then some things I jotted down as we went through this. You had mentioned in slide 4 that a 93% success rate in current FPP programs. So, and I think you even said that that's up to maybe 94% right now. What qualifies a family for those FPP services?
So when families are referred to the FPP services, they have to meet the definition of a candidate for foster care, which means that they are at risk of entry into out-of-home care absent the provision of those services. So those are situations in which the cabinet has substantiated some type of maltreatment, or if it is not a substantiation of maltreatment, the cabinet has made a family in need of services determination, meaning that absent the provision of services that maltreatment is likely to occur or entry into out-of-home care is likely to occur. Then depending on whether they have needs for in-home parenting skills or substance use or mental health, they have to meet the criteria for that specific evidence-based practice that is going to be provided. But every single family that's served under FPP is served either as a result of a substantiation of maltreatment or after an assessment or an investigation, the cabinet has determined that they are at risk without the provision of services.
So I would assume that with the programs that we have now, that we don't have the capability of offering that to everyone who would have possibly been eligible for that. Is that correct? So if that's the case, how many families of these children that are currently in care would have been eligible? If we were able to offer that to everyone, how many of them in care right now would have been eligible for those services?
So I think that until we are able to do much, much better in terms of primary and secondary prevention. There are always going to be situations that the immediate safety threat is too great even for FPP services. So certainly in situations of substantiation of sexual abuse where the perpetrator, still is a parent or still has access to the child, those are situations where FPP is never going to be appropriate. So I think it's hard to say of our current out-of-home care population. I think most of those, thinking of the statutory criteria for filing a petition for emergency removal, that threshold is really high. So most of those FPP services would not have been appropriate anyway. However, as I mentioned before, we do still have small pockets of the state where we have waiting lists. And unfortunately, there is probably a small percentage that if services had been available, then perhaps entry into care could have been prevented. It's hard for me to put a number to that because every case is completely different. And so, it's hard to say for sure. I don't think that that's a data point that we can provide. But I would say the majority of our children out of home care, the safety threat was too great. FPP wouldn't have been appropriate anyway. But I think certainly those areas of the state where we have waiting lists, that is a very valid question that we need to examine if there were children who could have been prevented from entry into care if services had been available.
And I completely understand the abuse situations without a doubt. But I also understand that a lot of the children that are coming into care, the majority is not over abuse, it's over neglect. And so wouldn't most of those children's families be eligible for something like this?
Sure. I'm glad that I'm really glad that you raised that point. The largest percentage of substantiations is for neglect. It is a very small, actually single digit percentage of the total families that are brought to our attention that end up in a substantiation of either physical abuse or sexual abuse. It does also, though I didn't say this before, it does also depend on the willingness of that parent to participate in services. So FPP services obviously can't be effective if the parent or caregiver isn't willing to participate in those. So that's another factor as well, in addition to whether there's an immediate safety threat. But I do think certainly eliminating those waiting lists is going to ensure that every family in the state who would qualify for those services is going to have access. And then I think we will truly know that those who are coming into out-of-home care are coming in 100% of the time because of an immediate safety threat that could not be mitigated through the provision of services. The other thing that I would love to mention that is relevant to your question is, as I said before, Kentucky was one of the first 5 states to submit a prevention plan and to be an early implementer to the federal level and to be an early implementer of Family First. And so now other states are approaching the deadline to implement on October 1st, 2021. We're starting to see some other states really being creative about their definition of candidate for foster care, and it is allowing them to serve even more families than what we're able to serve. So families, they don't have to have a substantiation, for example. And so they're thinking about risk of entry in a different way. And I think it's something for Kentucky to really keep an eye on because it would allow us to leverage federal funding to serve those families that fall into that secondary prevention category. So there's some type of risk, but before maltreatment occurs. So that is something that we're certainly going to continue to have conversations about and strive for. And we're watching whether these other states are going to have their plans approved at the federal level to know whether that's something Kentucky can replicate.
Well, I appreciate everything, your presentation, everything, Dave. Just a couple of last things here. Just from my standpoint, I understand some of the barriers you have with spending the money this year. For me, I want to make sure that we spend this money appropriately, that it is spent in a way that is going to be beneficial. And if that is the case and we can show progress, I think there are things that the General Assembly can do to help out in that situation of having to spend everything in this year. But I do really want to see some type of progress on this. And as we're talking about FPP having a 93% success rate, and I understand some families may not want to go into that or whatever it may be. But if we can get more of those families in, wouldn't it be more beneficial to start using money for things that we're already doing well with a 93% success rate, to pour more money into the FPP services to make sure that these families stay together at the front end? May be better than expanding some of these services, because again, this is one-time money and we have to be able to sustain this. So I'm just concerned about this money being used appropriately and being able to continue to sustain itself as we go forward. That's my biggest concern in all of this. So wouldn't it be more beneficial to expand on put more focus on those FPP services that we're doing well, instead of expanding new services right now?
MST is the only new service, and that is a pilot in just 3 areas of the state. All of the other services are existing services. So FPP and K-STEP are both existing under Family First Services right now. They both have a 93% success rate. Actually, FPP is up to 94%. So that is how the majority of the money appropriated is going to be used. The other things that I mentioned under primary and secondary prevention, those are also services that are already existing that also have tremendous success rates. They just don't fall under Family First because they're not families with a substantiation. But they also, and that's information we would love to share actually with the committee if the committee is interested, but we have similar success rates with our parent engagement meetings. And as I said, also, it's not just a benefit in terms of children not becoming child welfare involved, but it also is helping the school systems by improving attendance rates. So MST is actually the only new service that is being supported by some portion of this prevention money, and those dollars are very small. It's 3 small pilots in Jefferson, Northern Kentucky, and Central Kentucky.
All right. Well, thank you very much. I appreciate you being here today and presenting. And is there any further questions from any other members? Seeing none, we'll move on. Thank you again, Krista. We really appreciate it. Moving on. The next item on our list is the adoption process, cost, and timelines for related family members and foster parents. And at this time, I'll ask the judge executive if he wants to come forward. And at this time, I'm going to call on Representative Beckler. I believe that Judge Newcomb is your judge. If you'd like to introduce him and have a few things to say, you may go ahead.
Thank you, Mr. Chairman. Judge Newcomb is, in fact, my judge out in Crittenden County. And I want to thank him for addressing the committee today. He's a great leader for our county, and he's a pleasure to work with. I'm grateful that he brought this issue to our attention, and I look forward to his presentation. Thank you.
Thank you. And Judge, you may proceed whenever you're ready.
All right. Thank you, Mr. Chairman. I first want to start out by thanking each and every member for this opportunity to be here today to share the experience my wife, Tina, and I have just recently been through with respect to adoption of a granddaughter. I also want to apologize to this committee. I probably would have put together a PowerPoint presentation. However, I anticipated the majority of the members to be here in person, and I hated to bore them with another PowerPoint presentation. So hopefully everyone can follow along with me on this issue. And most generally, I try not to read my comments. However, due to this subject matter being somewhat overwhelming at times and such a sensitive issue, if you don't mind, I will read my prepared comments, and then if it's okay to expand periodically, I will do so from there. Thank you, Mr. Chairman. Again, it's my distinct privilege and honor to be with you today for the purpose of sharing experiences my wife and I have been through regarding the recent adoption of our granddaughter, London. I will begin today by providing you with a portion of our history that got us to this point, then provide you with some details of our adoption process, all of which have been a true learning experience for our entire family. Part of that learning experience led me to question some of the processes required and some of what I feel could be and possibly be considerable savings to our Commonwealth, all while easing the burdens of the adoption process through which we have just traveled, and possibly taking some of the burden off our foster care system. The history leading up to where we are today as a family begins in 2017 when I received a call from our local police department asking me to come to my daughter's home. I was informed the police and Department for Child and Family Services social workers were at the home investigating potential child endangerment issues regarding my granddaughter, London, who was at the time 2.5 years old. The home investigation was actually initiated by myself upon seeing the living conditions in which London was being kept, as well as statements made to me and my wife Tina by London herself saying that her mom's boyfriend had made her drink hot sauce as a form of discipline and had beat her with a belt buckle. London, from the time she was in utero, had been exposed to a drug-infused life of her mother's choosing, and neither me nor my wife Tina was going to stand by and let this continue any longer than it already had. Once we had London in our care, the lengthy process to this point began. First, as you are fully aware, we had to be awarded custody through an emergency custody order, which actually occurred rather quickly considering the circumstances. I will forego the details of the processes that followed the ECO out of respect of time and simply say that London's mother was granted a visitation schedule as part of her case plan, with which we completely complied. However, London's mother did not. She repeatedly missed the approved meeting times that had been set for visitations, and when London's mom did not show up, it was always later, or when she did show up, it was always later than scheduled, and she would only stay for a few minutes, then leave. Eventually, London's mother simply quit coming to visitations altogether, and we were awarded permanent custody status on that basis. London, like most other children caught in these situations, simply didn't understand why her mother would not want to see her. London would ask why she wouldn't talk to her, why she wouldn't play with her, why she wouldn't see her periodically, and on and on and on, which are very difficult questions to answer when put in that position. These children ride a roller coaster of emotions while going through this horrible situation, and in my experience, most of these situations are a direct result of parents valuing drugs over their children's lives, which puts these children in a place of feeling unwanted and uncared for. Every week, I see the impacts of children being removed from parental custody for one reason or another, as the cases come before our family court judge in the courthouse in which I work. Being put back into parental custody only to be removed again. These children become more and more confused at each occurrence, and I would say that it's not uncommon to see children in the hallways of the courthouse crying, trying to determine whether they're going home with mom or dad or a family member or a foster caregiver, which again is very difficult questions to answer. The process, again, these children become more and more confused of the process, and I feel need to have some stability and a feeling they are valued and cared for by someone, since their parents do not. From the time London came to live with us in 2017 until the time we petitioned the court for adoption this year, her mother had only seen her a handful of times and had not seen her or called her in over 2 years. It was clear to Tina and myself that we would be raising London as our own, and for us to be able to offer London the most protection we possibly could well into the future, we felt we should adopt London. We then spoke to London about being adopted, at which time she confirmed it was also what she wanted. So the journey to adoption began, as did my education of the processes involved, which is what brings me before this esteemed body today. Our first step was to hire an attorney to guide us through the legal process, which we did immediately upon making the decision to adopt. Our attorney also ensured first ensured London's mother had not made any recent attempts to be a part of London's life, which we explained the length of time it had been since London's mother had tried to contact her. Our attorney also ensured London's father had not made any attempts to be a part of London's life, and unfortunately her father had not been a part of her life since she was 6 weeks old. Neither her mother nor her father's whereabouts are known at this time. He then continued to proceed with his due diligence by asking our reasons for adopting London and if London was supportive of this decision, which we confirmed and provided our reasons. Our attorney then proceeded to explain the fees involved and the various processes that would have to be met. We found that there would have to be an attorney assigned to represent both London's birth mother and father, which we would be required to pay. An attorney would be assigned for London, which we would also be required to pay. Of course, the fee for our attorney, which we knew we would be required to pay. Then an in-home evaluation by either the Cabinet for Child and Family Services or a private social worker or home evaluator, with a fee to be determined depending on the route of evaluation available. And just for clarity purposes, that's anywhere from $800 and up. All told, an approximate fee for our adoption process would be nearly $3,000, standing at $2,700 or more. Our attorney went on to explain these processes generally would range in cost from $3,000 and up. Ours ended up costing us, at this point, $2,467.50, with some bills still remaining that have not been submitted for payment. This also did not include the cost for representation of London, because her attorney actually donated his time for this process. Fortunately for Tina and myself, we had the means from which we could bear these expenses. However, for many of the children, at least in our area, found in these similar circumstances, their families cannot bear the financial burden, which brings me to the many points of concern I have for this issue, which has become all too prevalent not only in the Commonwealth of Kentucky, but throughout the United States. Therefore, if you would allow me, I would like to submit the following for consideration. Understanding hesitancy to revoke parental rights, and with respect to every parent getting a fair chance at redemption, I would submit in these cases of clear abandonment, self-awareness of parents who understand they will never have the capacity nor willingness to provide for their birth children as needed, and in consideration let these abandoned, abused, and neglected children have rights as well. Perhaps there could be a process put in place that is not as costly or cumbersome, through which these children could be placed in a permanent, loving, caring, and safe home environment. Per the National Kids Count Information Database, as of 2019, there were 63,000 children in Kentucky living in the care of grandparents. I didn't see a consideration given for children living with great-grandparents, and perhaps that number is included with grandparents. However, I know of at least 3 families in our own community where great-grandparents are raising great-grandchildren. Also, the National Kids Count Information Database showed that in 2019 there were 87,000 children living with neither parent in the state of Kentucky. National Kids Count Information Database indicated in the period between 2017 and 19 there were 81,000 children living in kinship care situation where some family member was responsible for the care of children not in the care of their parents. National Kids Count Information Database between 2017 and 19, according to their information, in Kentucky there were 48.8 children per 1,000 ages 0 to 17 in Kentucky that were living in foster care. I would submit most of these children are on some type of assistance or full support of the Commonwealth of Kentucky, either by the provision of health insurance coverage, dental coverage, child support, or other costly programs that may be available or may be on all these means of financial support. All of this is absolutely necessary to provide the well-being of these children, and I certainly would not want to remove their support. However, if we could provide a better option through relaxed requirements for adoption or permanent placement, perhaps we could reduce these cost burdens to our state, all while providing a better solution to the children caught up in this extremely unfortunate circumstance of parental neglect and abuse. In closing, I want to thank you for your time and attention to hear from one family's experience with a very sensitive issue. One family's goal of protecting a child that had no means of protecting herself against the issues that were not of her choice, but of two parents choosing a path of self-destruction over the path of providing for their child. I'm not saying that at some point London's birth parents cannot make a change, and I pray they do, for the better. Nor am I saying any other neglectful or abusive parent in this Commonwealth may make better choices in their futures. What I am saying is that these children do not have the time to wait for that choice to be made, to have a chance at a better life. Upon the family court judge assigned to our case striking her gavel to signify London's adoption was final, and she now had the permanent parents and forever home she had hoped for, London turned to Tina and I, wrapped her arms around each of us as hard and as wide as a 6-year-old can do, and stated she had waited her entire life for this moment. Let's look at our processes and find a better way to provide children their opportunity to achieve a lifetime wish for permanency, if possible. Again, I thank you. If anyone has any questions whatsoever, I know I've tried to be as brief out of respect for your time, but I'll answer any question anyone might have.
Thank you, Judge. Are there any questions from members? Representative Beckler.
Thank you, Mr. Chairman. I had to find the unmute button. Thank you, Judge, for presenting. I know you and I have talked about this in the past, but would you share with the committee, if you have the numbers, the rough numbers, what the cost was for the Cabinet for Health and Family, DCBS, to come in to your house and approve things? And number two, if London's attorney had not offered pro bono services, what would that cost have been approximately, if you know?
Okay. Yeah, and Tina actually corrected me earlier after I had an opportunity to speak with Ben and Becky, both in their office this morning. The cabinet submittal for their fee has not been presented at this time. I talked with my attorney before this committee hearing and asked him if he had any idea, and he said generally those are $800 to $1,000. I will say that instead of coming to the home to do an in-home visit due to COVID, we were able to achieve that virtually, which I think is advantageous to some degrees. And then I question whether it's actually as thorough as possibly it could be or should be in other thoughts. I mean, I told Tina, I said, I guess if we were the type to have an unsafe home, an unfit place for our granddaughter to live in, we could have spruced up a few spots for the camera and stood in front of those and only shown those virtually versus knowing exactly what the entire dwelling appearance and circumstances were. And then with respect to London's attorney, the only thing I would have to base that on, Representative Beckler, would be a fee that was charged for her birth father, and that attorney charged $250. Her birth mother's attorney fee was $417.50. So,
who appointed those attorneys?
Those are appointed through the cabinet, to my understanding.
how many, while you had, during the time period when you had permanent custody, what was your interaction, or how many times did you interact with the cabinet, DCBS, anybody from the state?
Initially, it was rather frequently. Once we were awarded permanent custody, we had no further interaction at all.
So if I understand correctly, if you had not chosen to adopt London, and things would have continued on as they had in the past, the cabinet would not have, I'm not asking you to answer, I'm just making a statement that it seems to me that the cabinet would have not had anything else to do with you unless there'd been some kind of a charge against you or something had come up. So my comment to the committee is, in a case like this, I wonder why another visit is needed. And as the judge indicated, if a visit actually is needed, how can you do it virtually? My sense is that if the cabinet's not interested in checking out beforehand, there should be no need to check out things now. As I kind of run through this, the numbers, Judge, that you presented, if things hadn't been presented pro bono, and if you'd had all the bills, instead of about $2,500, you'd have been up in the neighborhood of about $4,000. And I know that you and Tina were able to afford it, were able to do it. But like you, I think there are too many people in our community and throughout the Commonwealth that would not have the money, not have to be able to do that. So I think that we need to take a real look again at DCBS processes and try and figure out what can be done, because I'm not sure $800 would cover what DCBS might do if they came to one's house. So, Mr. Chairman, I want to thank you for allowing Judge Newcomb to present. I think his concerns are legitimate. I think that we need to take a look at what the cost is, both for the Commonwealth and for individuals who might not be able to afford things. And hopefully we can all work together to get that done when we get back in session. So at this time, I have nothing further to say or comment, but you know me, both Judge and Mr. Chairman, that doesn't mean something else won't come up and I'll have to say something again, but thank you very much.
Thank you. Senator Berg. Senator Berg, if you're speaking, we can't hear you. All right. We can come back if there's something else we need to add to that. Judge, is there anything else that you would like to add to the presentation?
If you don't mind, Mr. Chairman, I would like to respond to Representative Beckler's comments regarding the home visits. And then I saw Senator Berg pop in there, so possibly she's got that resolved.
Yeah, we'll go back to her.
With respect to the in-home visits, we were required to have an in-home visit prior to permanent custody being awarded. In fact, even prior to temporary custody, DCBS did come in and do an in-home visit and evaluation of our living conditions and what have you. And then I'm sure, had there ever been trouble or been a problem, I'm sure DCBS would have been notified and would have come back My question initially to Representative Beckler was because they have no record of any issues or have no requirement or need to be back in the home because of any potential situation that might arise, why then prior to the actual awarding of a final adoption, they seem to want to come in and do another visit when there's not been a requirement to do so. And it just seemed somewhat redundant to me, I guess. And I would submit that might be a consideration to look into through this process as well as a possible savings at some point. I know that's an awful lot of children, an awful lot of responsibility. But when you have clear cases that have no history of issues, once those children are placed in the temporary custody situation, just seems odd to go back in and revisit that.
You're exactly right. As an adoptive father, there's a lot of redundancy in both at the state and federal level. We were a federal adoption, so I understand exactly what you're saying there. And we may get some of those things clarified in just a few minutes when the cabinet does their presentation. But I'm going to go back to Senator Berg. I think she's available now for a question.
Yes.
I am, sir, and thank you very much. I'm sorry my computer froze right as I was wanting to speak. First of all, Judge, I would really like to thank you for sharing this. This is not an easy story to share, and many, many people in the state, myself included, have been through the horror of trying to get a child out of an addicted family member's home, and what it takes and how much money and how much time and how much energy. And I want to say that without question, I believe that for those families who cannot afford the cost of adopting these children, we should have a way to step in and help. Because as in your case, in the long term, to get these children into good, safe housing, not only does it save the state money, but it gives the child a chance that they wouldn't otherwise have. So first, I just want to say thank you for sharing. Second of all, I agree wholeheartedly with everything you are saying. And, you know, it takes a lot to stand up in front of people, particularly in an empty room like you are, and share these type of things. And I just want to say, I wish to God I was there in person to listen to you, and thank you. Thank you for coming forward and talking about this.
Thank you, Senator Berg. I appreciate that very much.
Well, thank you, Judge. If there's anything else you'd like to add, you're more than welcome. But if not, Judge Newcomb, thank you for coming and sharing. I know it's difficult to share a personal story, and we appreciate it. We can't learn without hearing those stories, so we appreciate your time.
Right. Well, it's my pleasure. I just, seeing it on a weekly basis as I do, I can't help but know there's other children out there in the same circumstances. And I understand the difficulty in terminating parental rights and the hesitancy to do so. But at some point, I think these kids also have an equal amount of rights to be protected and be provided an opportunity. And I know in London's case, our adoption was finalized July 16th, and she has been a totally different child, even from where she was at that point. She's more at ease. She's more attentive. She just knows she has that permanency now, and you can tell that through her actions. So I appreciate your time, Mr. Chairman.
Thank you, sir. And I'm going to call on Representative Beckler one more time for some final comments as well.
Thank you, Mr. Chairman. Judge, I just want to apologize for me not being there in person as well. I think you know the condition of our farm and barn and everything, and still trying to clean up. Probably not a good excuse for not coming up, but that's my story, and I'm sticking to it, as they say. But in any event, I do want to apologize for not being there in person to support you. And once again, thank you so much for your presentation and for bringing this to us.
Yes, sir. No apology necessary. And thank you.
Thank you, Judge. Next, I'm going to call on Mary Carpenter. I think she's got a presentation on the adoption process as well. So, Mary, you're more than welcome to take off when you're ready.
Thank you. I am going to share my screen. I do want to thank you all for having us here today. My name is Mary Carpenter. I am the director of the Division of Protection and Permanency. And I also have Veronica Sears here with me today, and she is the Adoption Services Branch Manager in the division. So I want to give an overview of the Adoption Services Branch, which covers a lot of responsibility. They receive all adoption petitions for the state, and they assign the relative adoption petitions that Judge Newsom was just talking about to the local DCBS offices for completion of the court report. They review and present non-relative independent adoptions to the DCBS Commissioner's Office for approval. They administer the Kentucky Adoption Profile Exchange, which I will talk a little bit about later. They administer the Putative Father Registry, which was established in House Bill 1 from the 2018 session. They have an adoption disruption specialist that consults with regions, being the point of contact for post-adoption placement stabilization services, which Krista actually touched on briefly in her presentation. And they administer adult adoptee searches and non-identifying information requests for families. So for the purposes of today's presentation, I am going to focus on foster parent adoption processes, but if there are questions at the end, we can certainly answer those regarding relative adoptions as well. So in July, there were 9,170 children in out-of-home care. Of those, 3,159 children have a goal of adoption. And of those, 1,615 are legally available for adoption. 983 of those are in the process of being adopted by their foster parents. So when I say a goal of adoption, I'm referring to the permanency goal for that child. The permanency goal when children enter care is always reunification. And then at the point that a parent can no longer mitigate the risks and they're not making progress, we will seek a goal change to adoption. House Bill 1 did decrease the timeframes for filing adoption petitions. It required petition of termination of parental rights to be filed within the by the 15th month that a child has entered out-of-home care, and once they've been in care for at least 48 months. And so children are legally available for adoption once they have a completed termination of parental rights or a TPR. So in some cases, a parent may desire to voluntarily terminate their parental rights. There are different factors that impact whether or not it's a voluntary termination or an involuntary termination. Some of those factors might include the parent's mental health or functioning. If there are cognitive delays, typically we would not pursue a voluntary TPR because of their decision-making capabilities. If a parent cannot be located or paternity is uncertain, it may have an impact on the type of petition that's filed. And then the actual circumstances of the case can also be a factor in determining whether it's an involuntary or voluntary. So this chart shows the length of stay in DCBS custody by the type of termination of parental rights. The length of stay for a youth with an involuntary TPR was on average 1 to 2 months longer for 2019 and 2020, averaging around 33 months for a voluntary TPR and 34 and a half months for involuntary TPRs in 2020. So once the TPR judgment is actually entered and the TPR is finalized, regardless of whether it's an involuntary TPR or an involuntary TPR, the adoption process is the same. So a parent may file a voluntary TPR petition themselves through their attorney, but these processes are outlined in statute. KRS 625.040 outlines the voluntary TPR petition, and 625.050 outlines the involuntary TPR petition process. So the first step, once TPR is actually granted, as far as the DCBS processes go, is completion of a presentation summary packet. And that's required within 10 working days from the TPR. And I'm going to talk a little bit about what's required in that packet on the next slide. So KRS 620.180 requires a copy of the presentation summary to be filed with the court within 30 working days. And the purpose of the presentation summary packet is to provide those adoptive parents with information about that child, information about the child before they came into out-of-home care, information about the biological family, their placement history, and any current needs that that child may have. So this is a busy slide, but this is the information that is in the presentation summary packet and consists of the PSP packet. It has a narrative, includes a narrative about the child, their medical history, any other pertinent information regarding the child and their birth family. There are times when records may be waived. If the child hasn't been in the same foster placement for 12 months or longer, we allow some of the records to be waived as long as that foster parent is adopting the child. And if the child is less than 12 months of age and has maintained that same foster home placement and is being adopted by that foster parent, some of those documents can also be waived. In the presentation summary packet, we also include a consent or a refusal for that biological parent to inspect adoption records from the adult adoptee once they reach the age of 21. We're assessing and documenting any sibling separation issues. And if it's not already been completed, the foster family signs the intent to adopt at that time, which is included. Recruitment and certification staff, which is the social service worker for that foster family within DCBS, then shares the presentation summary packet with the adoptive family and reviews the child's history and any current needs. And that at that point, they begin discussing the subsidy with the family. If a child is placed in a private child placing home and with a private agency, that home actually transfers to DCBS and is approved as an adoptive home because we are the Title IV administering agency and we oversee the subsidy cases. So who qualifies for adoption subsidy? States are required to enter into an adoption assistance agreement when a child meets one of these special needs criteria. Each state determines what their special needs criteria is, and our special needs criteria is outlined in statute. It's KRS 199.555. So many children that are in foster care do meet that special needs criteria and are eligible for an adoption subsidy. The packet includes adoptive placement agreements and these adoption assistance agreements. So they must meet at least one of these criteria. They can have a physical or mental disability, an emotional or behavioral disorder, have a recognized risk of physical, mental, or emotional disorder, be a member of a sibling group in which the siblings are placed together, have had previous adoption disruptions or multiple placements, be a member of a racial or ethnic minority, or at least over the age of 2, and or be over the age of 7. So the subsidy consists of 3 components. The cabinet does pay up to $1,000 per child in non-recurring fees, which is the one-time payment, which may include costs associated with the foster parent adoption, which includes fees such as the filing fee, attorney fee, and the guardian ad litem fees. And then the adoptive family is responsible for those additional costs. It includes monthly maintenance, which is the actual dollar amount itself received to support the actual needs of that child. And then it can include extraordinary medical, just depending on if there are specific services that are needed for that child that insurance or Medicaid does not cover. An example of extraordinary medical may be childcare. So there are other benefits that are available for children and families adopted from foster care, which include a medical card, the adoption tax credit. The tuition and fees are waived for any public or college or university in Kentucky for any child adopted from foster care that has special needs. And then the educational training voucher is available for children who were adopted from DCBS and over the age of 16. After they have to be adopted after the age of 16, and that may be applied to like a job training program if a child doesn't want to attend an actual university. So once the subsidy is approved and with there's an agreement about that, the adoption petition is actually filed. The petition is filed by the adoptive family's attorney. That recruitment and certification staff complete the court report and the consent to adopt. And then statute does require that the cabinet file that report no later than 90 days after the adoptive placement or the filing of the petition. The court actually appoints the guardian ad litem who's responsible for completing a report within that 90-day time frame as well. And then the adoption hearing is held and the judgment must be entered into the record. There's no time frame for finalization. It's dependent really on the attorneys involved and the availability of court dates. So this chart shows a number of adoptions finalized over the last 7 years. You can see there was a decline in 2020. We did work with the administrative office of the courts in 2020 to attempt to prioritize cases where we knew adoption petitions had been filed and were close to being or could be finalized if we just had a court date. So we provided them with a list of about 230 children and worked with them closely to try to push those along. So I mentioned post-adoption placement stabilization services earlier. We refer to those as PAPS. In 2019, the Adoption Services Branch established a position to focus on families who may be at risk of adoption disruption. This specialist is our statewide point of contact. This is an optional service available to adoptive parents on a voluntary basis, and they may request this if a child is close to disrupting from their home. And the conditions are outlined in regulation. It's 922 KAR 1530, and some conditions must be met in order to qualify for PAPS. And they must have exhausted in-home services or services in communities. The children must be leveled through a contractor that we have with a Children's Review Program, which is really to identify that there is a treatment need. And these children typically do go to a residential or congregate care setting. And so we want to make sure that there's an identified need there and that the parents must be willing to participate in the child's treatment and willing to work towards their return home. And then the subsidy is reduced during the PAPS placement. The PAPS cannot extend beyond 90 days for a 12-month period. During that period, the adoptive parents do retain custody of their child. After 90 days, if continued treatment is needed, a voluntary commitment may be pursued, which is basically an agreement between the cabinet and that parent to allow that child to receive the continued treatment that they need. In 2020, we had about 14 PAPS cases. So far in 2021, there were 23 cases. We've been really working closely with Aetna Sky since that launched this year to identify and provide supports to these families, which is helping, I think, to get them the services that they need. We've updated our own policies and provided guidance about these services and really just trying to be more intentional about monitoring and tracking these services and to really support them. So I also mentioned CAPE earlier. CAPE began in 1979 and as the Kentucky Adoption Profile Exchange and was formerly known as SNAP, which was the Special Needs Adoption Program. It was developed in response to the increasing number of children spending too long in foster care, and really seeks to identify adoptive families for children who are legally available for adoption but do not have an identified home. Currently, there are 632 children who are legally available for adoption without an identified home and registered with CAPE. In late 2020, work began on the development of a partner site with Adopt US Kids. So this was a new website for CAPE, and it launched this year. The previous site was really antiquated and was not very user-friendly for families who were seeking to adopt. And so this has allowed for more of a streamlined process of placing children on the websites and closer monitoring of the children's statuses to be able to more efficiently track child-specific adoption inquiries. We've rolled out trainings to support this and to really update folks on their roles and responsibilities as it relates to recruitment of children with these needs. So we have had some successes related to permanency following House Bill 1 in 2018, and with our child welfare transformation efforts. We really took a look at our foster care and adoption processes from the point of foster parent inquiry to adoption finalization. And one of the barriers that kept surfacing was the presentation summary packets that I spoke about earlier. Those were taking a long time to gather documents, and there were delays with that process. And we know that we do need those packets because they educate adoptive parents and adoptees even later in life will need those. But we were able to reduce some of the paperwork that was required in instances where a foster parent was adopting a child that they may have brought home from the hospital, and they already knew that child's entire medical history and those types of things. So we have seen an improvement with the completion of more timely presentation summary packets, which had been a bottleneck for kids lingering. Additionally, the e-filing of TPR petitions has been very beneficial, which saves time. We had seen delays also with, once the goal was changed to adoption, with just the filing of those petitions. So we have seen that has helped with moving cases along. And then just our collaboration with the administrative offices of the courts has greatly improved, and we have developed a standing communication plan, which is really about sharing data to be able to identify any trends in permanency, which really is meant to be local, sharing permanency trends within that jurisdiction, because really that's where all the hard work has to happen. And so we're hopeful that increased collaboration will continue to help us address barriers that we're seeing, on both sides. We have an ongoing cross-training series of webinars where DCBS as well as AOC or a judge are doing those trainings together. Those are running through the end of the year, and we've had really positive feedback about those. And then we have our judicial engagement work group that consists of DCBS leadership, judicial leadership and judges, AOC, to really help problem solve when there are barriers and work through those as a group together. And then finally, just some of the barriers that we do see and that we hear from our staff. The number of TPR appeals seems to be increasing, and then just the amount of time it takes to resolve those is lengthy. So, which causes delays with adoptions once there is an appeal filed. The frontline staff report difficulty obtaining court dates and goal changes. And so those are things that we problem solve with, the administrative office of the court. DCBS turnover and vacancies are a barrier. every time a new worker comes onto a case, that's a setback, for that family and could, potentially delay permanency for that child. And so that continues to be an issue. And then the pandemic did result in fewer contested TPRs, meaning, those involuntary termination of parental rights being held in general. So we are seeing right now just an increased number of pending TPRs because and they're not being scheduled. And so that has caused some delays. Also during the pandemic, we had a hard time getting those social security cards, which, those adoptive families need those and are part of that presentation summary packet, and that caused some delays. And we were able to work through that with the Social Security Administration, but that caused a little bit of a bottleneck as well during the pandemic. So that was a lot, and I am kind of breezed through that because I know we're short on time, but I would be happy to take questions, and I just appreciate you guys having us here today, and thank you all so much for letting us talk about this.
Well, thank you for your presentation. I just got a couple of quick questions. On average, barring COVID, I understand that threw a wrench in a lot of things, but on average, how long after these children are legally eligible for adoption is that adoption complete? I know that there's some who don't have a waiting home, but for those who do, how long? What's kind of the average time period there?
So I would have to take a look at that. That average length of time in general is 33 months. I would, Veronica, I don't know if you know this or not, but I think it's around 6 months from the time of 6 to 9 months from the time that TPR actually occurs.
Okay. And then as you talked about the presentation summary packets, what is the average time on getting those completed as well?
So there's virtually no delays right now with presentation summary packets. We've really, that's something that we focused on heavily after House Bill 1 and really monitoring those. And so they're starting working on those prior to the actual TPR happening. And so that once, once the TPR is actually granted, it's already ready. So there's really virtually no delays with that at this point.
All right. Thank you. Are there any other questions from any other members? Representative Beckler.
Y'all are probably, thank you, Mr. Chairman. You're probably getting tired of me asking all these questions, but I can't help myself. Ms. Carpenter, could you go back to slide 4 for a minute, please?
Sure. Let me share my screen again. No, sorry. I'm not very proficient here with Zoom, so let me just scroll back. Is this
all right. Yes, ma'am, it is. Thank you. I'm a little confused, and maybe you answered it when you're talking to the chairman, but what do these numbers actually mean? Do these numbers mean that once the parental rights termination has been granted, regardless, that it takes almost 3 years for an adoption to be finalized? Is that what this is saying?
No, this is the total length of time, regardless of the TPR, that total length of time in care.
So this would include the time that a child was in foster care, is under you guys have responsibility. Is that correct?
That's correct. It would be from the removal to the adoption finalization.
When you talk about removal, though, is this include the first removal, or does this include the 15 months within 48 months that you're required to do things? I'm still having
It
trouble.
does. Yeah.
understanding
The
this.
point that child is legally placed into the custody of DCBS. So whether that's an emergency custody petition or if that happens, through a different means, but the point that DCBS actually has custody, this would be the full time frame.
Do you know how this compares to other states?
We do have that information that I could provide. I don't have that readily available today, though.
I would like to see that. If you would just make sure staff gets it, and I'm sure it can be sent to me and anybody else who's interested. And on slide 18, I know now I'm asking you to go forward. Thank you. Down where you say there is an increased number of pending TPRs at this time. Is that a statement in relation to last year, or is that a statement in relation to what you've seen over the years, over a larger period of time?
It's a result of the pandemic. So, there are jurisdictions that are holding, that have been holding virtual or video conferencing, as a means of their docket is, virtual at this point. And so we, during that time, judges were hesitant to hold TPR hearings virtually. And so they just weren't being scheduled. And then, we had a handful of jurisdictions where judges did not return to face-to-face or haven't returned. And so we're trying to work through that. And so those just aren't being scheduled. And so those are issues that we are trying to work through, with AOC.
So do I understand correctly that a contested TPR is one where one or both of the parents are saying, wait a minute, this should not happen? Is that what that?
That's correct.
All right. And so the fewer contested TPRs doesn't really have anything to do necessarily with the increased number of pending TPRs, or it does? I'm trying to figure out if there's a relationship between the two.
So Veronica, can you help me out here? Veronica is on our permanency calls. And so
Yeah, absolutely. So like Mary was saying, during the pandemic, judges were reluctant to hold contested TPR hearings. So meaning if the parent was not voluntarily terminating their parental rights, those hearings were not held. And now as we're transitioning back to being in the courtroom face to face, there's just a larger number of cases pending TPRs at this time that need to go before the judge.
So that the pending are both contested and non-contested?
True, but a larger number are probably contested.
Okay. I may come back to you with in writing with some other questions, but I know that everybody needs to get going. So thank you for your presentation. Thank you, Mr. Chairman, for your indulgence.
Thank you. And one final question, Mary. On those numbers for time and care with children, is that a cumulative time? So if a child goes in, comes out after 3 months, and then is out 3 months, but then goes back in, does that accumulate, or is that each time that child comes out and goes back in, does that reset?
So the time for that chart, that is not cumulative. I think it was that one episode. However, when we're looking at whether or not to file a TPR petition, and we are looking at that cumulatively. So, but for that data piece, it's not going to capture prior episodes in out-of-home care.
Okay. Thank you. Are there any further questions? Well, again, Mary, thank you for being here. Thank you all the presenters for being here today. We appreciate you and your time. One last announcement is the committee will not meet in September, but we will be meeting again Wednesday, October the 13th of this year. So with that, keep that in mind for those members, and we will see you in October. With that, we are adjourned.